Hello, Dr. Doobie here to talk to you about what to do in this first phase. Now, in this first phase, I want to first cover the do's and don'ts because these are important. The first thing I want you to do is get up and walk. I know this injury, this pain has been nagging for some time and it's annoying. However, the less active you are, the stiffer, the more irritated this gets. The more you move, the more your nervous system will calm down and you'll get better. Now, I don't want you sitting for very long periods of time. If you have a desk job, try to stand up at least once every hour, whether it's for 5 minutes or 10 minutes. Just getting that body in that fully erect position will be really helpful. Also, if you do any type of labor work, whether it's in the garden or in a warehouse or laying wires down or whatever the job is, if you're bending for long periods, try to set a reminder to sort of stand back up after X amount of time. You can gauge this based off of yourself and what makes you feel the best. Okay? Now, the next things I also want to talk about are just simple things that I usually have to cover with everyone in the clinic. These are important because these things can really irritate people because they do it every single day. For example, getting in and out of the bed can be very irritating. You sleep every night. Doing it wrong can be irritating. If you get in and out of the car constantly, it can be very irritating. So the first thing I want you to do when you're getting into the bed is I want you sitting at the edge. When you're sitting at the edge, I want us to go down on one side, have our legs come up. You can straighten the legs out, and then from here you can lay on your back. Okay? And then you'll do that same thing to get out of bed as well. In order to get out of bed, we'll go ahead and lay to our side. We'll bring our legs up. We'll have our legs off and we'll push up. This is an important concept because this guarantees that you put as minimal stress on your back as possible when getting in and out of bed. Now, also, when you're laying in bed, a lot of the times having something under your knees allows that tension of your low back to go away. Whether it needs to be here or just something as little as this, it takes that tension away from your low back, which is very important. Okay? And if you're a side sleeper and you don't sleep on your back, then having something between your legs to make sure that your pelvis is even and you're not putting additional stress on your low back is also very important. Okay? And then the last thing is getting in and out of the car. Let's go hop to my car so we can cover that. So it's really important that we just don't come here and throw our leg way up. As you can see, I have one leg planted. I'm twisting my spine. My core is working more than it should. It's very stressful on the back, especially when your nervous system is in overdrive. So what I want you to do is go ahead, sit at the edge, try to scoot back, straight back. Once you're sitting down, pivot those legs in, and now you're sitting in your car. From this way, we do the same thing to get out. Bring the legs over, face outward, slide forward, and then stand up. And that's the do's and don'ts and the tips and tricks and how to start getting better. So the first 3 that are not stretches that's going to help activate the muscles in our core is going to be diaphragmatic breathing. It's going to be posterior pelvic tilts, and we're going to do supine lumbar rotations. So I'll show you the first one, supine lumbar rotations. This is going to be as simple as just laying here, putting our feet together, and going side to side within our pain limitation. Okay? It's important that we try to keep our upper body still, rotating at the core. And if this is irritating, just go a little less distance. If this is irritating right here, then just stop a little before that and then slowly start to work up to your max range of motion. If it's very minimal first, work up to bigger range. Okay? Now this second one is diaphragmatic breathing. If you take a deep breath, you can either see it come in through my stomach or my chest. And if you breathe through your stomach, then you're doing it appropriately, and we want to keep reinforcing that. But a lot of the times with my patients with low back pain, they're going to be breathing through their chest. So I like to have 2 hands here. Take a deep breath and then feel yourself push into your lower hand right here. without your upper hand moving. This ensures that you're using your diaphragm to breathe appropriately. This is important because your diaphragm is a part of your core, and if it's not working, everything else is going to be stressed more, and the whole system as a whole is not functioning appropriately. The next one is posterior pelvic tilts. And also, you can note while I'm doing all these, my legs are up. This is going to be the most friendly position for your low back. Keep them in this position if we can, while we can at all times. This next one is going to be posterior pelvic tilts. And a lot of the times I'll like to set something, whether it's a towel or something underneath my back, and then I'll just go ahead and bring my belly button down to the mat, and then I'll relax. So it's the opposite of arching our back. So if we're arching our back here, now we're doing the opposite, and we're pushing our stomach down into the mat, okay? These three things are key to getting our nervous system down and under control. The legs can stay up until you're comfortable to lay all the way straight flat. If laying flat does not bother your back at this time, then it's up to you whether you want to do that or not. But all of those exercises are important to getting the initial muscles engaged of your core so that we're heading in the right direction. The next three are stretches with common problems: the piriformis, the QL, and also your hip flexor. So the first one being is a piriformis. We can do this laying down while we're here. If we put one leg here, all we can do is walk our other leg up, because some people might start right here. But if we walk it up, now you might start to feel that stretch in the backside of your butt, and that's where we want to feel it. Or as you get more flexible, you can bring it forward and then try to keep your legs straight coming towards you. And for me, I start to feel it right here, but you might not get there. So this next exercise is for your hip flexor. This is important because this will commonly get tight in people that sit for long times, and then you have that pain in your low back. So for this one, I want us to have our knee down on something. Make sure we have a nice upright, tall posture. From this position, we can actually stick our butt out, but we also want to do the opposite to target this stretch. So we'll tuck the butt in. This is a posterior pelvic tilt, and then you should feel it right here. And if not, you can go forward slightly, but keeping that butt tucked, okay? So remember, arch your back, and then we want the opposite, and that's just a good way I cue my patients to make sure that they're targeting this appropriately. And you should feel it right here in the front. And then the final exercise is a QL stretch. And you can do this in this same position with you kneeling down. So what you're gonna do is you're gonna have one knee down, and then that's the side that you're gonna stretch. And from here, you're just gonna go over, and you should be able to feel that stretch on this side of your back. And from this way, you can hold this, and then you're able to also switch, and you're able to do it on the other side as well. For me, my right is a little bit more tight. So this is the conclusion of phase one. Make sure you do these things to help calm the nervous system down, and you have the do's and don'ts. You want to make sure you're activating the appropriate muscles first to start that foundation of the core, and then you'll do these stretches to also help reduce any tightness in those common muscles that are irritated.